Hello, dear viewers. Welcome to Ulken on Kazakh TV. It's no secret that some people are affected by COVID-19 more than the others. Risk groups include patients suffering from high blood pressure or poor blood circulation, people with chronic lung diseases, diabetes, liver and kidney diseases, those with compromised immune systems, as well as old people. So, how does this virus affect people at risk?
Coronavirus is a disease that has shaken the world to its core. Even the superpowers are helpless in the face of the pandemic. To put it simply, the body is intoxicated.
But it hasn't been studied properly yet.
We found out that some people suffer severely from the COVID-19 symptoms.
Who are the most affected?
Well, in most cases, men are being admitted more often,
I need to tell this to my husband.
and there is no obvious reason to that.
Too many people just take off their masks when visiting markets.
Experts say that this risk group includes the elderly and people of any age with underlying health conditions.
We couldn't protect ourselves. Anyone with underlying health conditions is at risk.
Who's at risk when it comes to coronavirus? What else do we need to know about the disease that is taking over the world?
Can people infected with the coronavirus develop heart problems? To discuss this topic, we invited Saken Murasulu, the head of the Department of Interventional Cardiology. Saken, welcome.
Good afternoon. Saken Anartayev, Head of Department, City Clinical Hospital number 7. Head Department of Interventional Surgery and Arrhythmology, first category doctor, currently doing his PG in public health.
Saken Murasulu, first of all, what's the difference between interventional cardiology and traditional, commonly known cardiology?
Interventional cardiology, unlike traditional cardiology, is, well, interventional cardiologists perform intravenous surgeries on patients with heart diseases without opening the chest, meaning that
Without using a lancet.
without using a lancet, because we will use angiography machine to perform that intravenous surgeries. This is the main difference between us.
Which one is more relevant today, when the COVID-19 cases are increasing?
Traditional cardiologists treat with drugs, and we perform intravenous surgeries like vascular reconstructions, and they are usually performed through pierced skin. So it is impossible to say which one is more effective when it comes to COVID-19 pandemic.
Қайсысы тиімді осы коронавирус кезінде деп оны айтуға болмайды.
Both are suitable.
Екеуі де тиімді, екеуі де
Both are effective and both are needed during
керекті
the pandemic.
болып табылады.
Saken Murasulu, so how does the coronavirus affect people with high blood pressure?
Адам ағзасында жоғарылаған кезде
People with high blood pressure usually suffer from headaches,
ауруына қоса
chest pains,
жүрек
and shortness of breath.
қысып ауырсынуы,
And when this condition is being exacerbated by coronavirus,
осындай шағымдармен жүріп жатады. Осындай науқастарды
it is important to prescribe
коронавирус
antihypertensive drugs
қорланған
that can lower blood pressure.
антигипертензивті қан қысымының деңгейін төмендететін дәрілерді тағайындау өте маңызды болып табылады.
Saken Murasulu, there were reports that people who have been taking antihypertensive drugs for an extensive period are more likely to catch coronavirus. How true is that?
Гипертензияға қарсы
As I said before, patients with high blood pressure who take antihypertensive drugs can experience chest pains and shortness of breath.
барған кезде ентігумен бірге қосарлана жүруі мүмкін.
Also, the stress is known for worsening people's health condition, so this information can add more stress to their lives.
Сенен бастап күйзеліске, қорқыныш, үрей,
Panic.
It can stress them out.
билеп,
This.
сол себепті
This information can really affect their well-being as it can cause vasoconstriction, which usually results in high blood pressure.
So psychological condition is no less important, right?
In our everyday practice, we see patients in a positive psycho-emotional state, and despite their chronic high blood pressure, they develop only minor symptoms of COVID-19, and treatment works on them better.
Ол біздің тәжірибемізде күнделікті көріп жүрміз.
Sakin Morasula, and what can you tell us about the pulmonary artery thromboembolism caused by pneumonia?
Коронавирус инфекциясының салдарынан пневмония дамып,
If patient develops pneumonia due to coronavirus infection, or if there are any inflammatory processes happening in his body, usually it can result in formation of blood clots.
инфекциялық синдромның арқасында жәндегі адам ағзасынан сұйықтықтың
This happens because his patient is being dehydrated or is developing intoxication syndrome. Therefore, and speaking from my own experience, people with coronavirus infection often develop pulmonary embolism.
дамып жатады. Ондай науқастарға
In order to avoid these complications in such patients, the coronavirus infection treatment protocol instructs prescribing anticoagulant medications.
емінің протоколында антикоагулянттар,
Antiplatelet drugs, and in the case of
егер
thromboembolism,
болған жағдайда
thrombolytic therapy can be needed.
сол емді жүргізу жазылған, көрсетілген.
So this is very important.
Yes, this is considered extremely important.
And what are the symptoms of intoxication?
Well, due to the inflammatory process, the body can develop symptoms of intoxication syndrome. They include
Poisoning,
Уланады.
poisoning, yes. Simply put, the body is poisoned.
Оған
These symptoms include headache, weakness, sweating, dryness of the skin as a result of excessive sweating.
терінің құрғақтығы, терінің эластикалығының төмендеуі,
Decreased skin elasticity, vomiting, nausea,
іштің
and diarrhea.
өттердің барлығы
All these symptoms are sign of intoxication.
адам ағзасының улануының белгілері болып табылады.
is it possible that people who have had coronavirus can later develop heart diseases? I mean, after they have been cured from COVID-19.
Коронавируспен ауырғаннан кейін болмақ
As a result of coronavirus infection,
жатқан
blood clots can possibly form in human bodies.
жәндегі тромба
These clots can result in coronary occlusion, or it is also possible for pneumonia to spread into the heart because of high levels of lung inflammation,
деңгейінің жәндегі үлкен
or because of the patient's weak immune system.
адам ағзасының
This is called myocarditis.
жәндегі
Myocarditis is an inflammation of the heart muscle caused by a virus.
кардит деп атайды.
These patients develop pulmonary insufficiency due to the inflammation of the lungs.
қабынуы. Ол жәндегі
Heart failure develops due to inflammation of the heart.
салдарынан
Therefore, the patient's conditions worsens.
жүректің қабынуының есебінен жүрек жетіспеушілігі дамиды. Сол себепті науқастың жағдайы ауырлайды. Оған
So do you operate patients with these health conditions whether they are COVID positive or not?
егер науқаста мен айтқандай
If, as I said, the patient has inflammation of the heart
ондай
muscle, then such patients are not supposed to be operated on.
кезде
In such cases,
дәрімен
conservative treatment with ordinary drugs is used.
егер коронавирус әсерін
If the coronavirus does not cause a blood clot to form in the body, a blood clot will form between the plaques inside the blood vessel. In such patients must undergo surgery if you want to save their lives.
бұл мақсатында ота жасалынады.
Sakin Morasula.
Sakin Morasula, we hear that so many people who had coronavirus were taking blood thinners. How do they affect the body?
Қалдырмай ма ағзаға?
антикоагулянт дегеніміз бұл ағзадағы қанды сұйылтып,
Anticoagulant drug is a blood thinning medicine that reduces blood coagulation and prevents blood clots from forming.
өсуін тежейді. Сол себепті
If the blood clot has already formed, it prevents it from growing further. Therefore, anticoagulants are prescribed to these patients.
антикоагулянтты жәндегі мөлшерін
If patients take too much or too little anticoagulant at home, it can result in various lethal complications.
әртүрлі өлімге алып келетіндей асқынулармен
Therefore, anyone should first of all consult with a doctor before taking anticoagulant drugs.
учаскелік дәрігерімен ұсынысы бойынша қабылдау тиіс.
I've also heard that AC inhibitors can complicate the course of the disease. What can you tell us about it?
АПФ ингибиторы бұл осы коронавирус инфекциясы кезінде тағайындалу керек пе?
Numerous studies have been conducted on whether ACE inhibitors should be prescribed for patients with coronavirus infection.
қалалық ауруханада болған бір мысалды келтіріп өтейін. Біздің
Here's an example from City Clinical Hospital number 7. A patient in our hospital was diagnosed with a coronavirus infection. The result of his test was positive.
тексеру барысында компьютердің томография жасаған кезде
CT scan showed that the lung damage did not exceed 1%. His oxygen saturation levels were at 98-99%.
көрсеткіші 98-99.
In such cases, there is no way the patient can suffer from shortness of breath or chest pain.
жүрек тұсының ауырсыну сезімі ондай болмау керек болатын.
But when we were examining him, we discovered that his blood pressure rose to 200-100 mm Hg, and that his blood pressure was still rising. The patient was prescribed an ACE inhibitor. After that, his blood pressure was restored. He had no more complaints, and later, this patient was discharged from the hospital. He went back home, and this is why...
There can be positive effect too.
Exactly. There are positive effects in ACE inhibitors administration. It is a necessary drug when it comes to fighting coronavirus infection. However, this drug has one side effect. It can cause a dry cough in some patients. Therefore, if a patient with a coronavirus infection is prescribed an ACE inhibitor, it is important to know whether the cough is caused by pneumonia or an ACE inhibitor. In such cases, hospital doctors or local doctors can take care of these patients.
Some COVID-19 patients have tachycardia. Others sweat a lot. It happens that these symptoms persist for quite some time. What do you think about it?
First of all, this all depends on the percentage of lung damage. The recovery process is different from patient to patient. Every single human body has a different ability to adapt. Therefore, I firmly believe that patients who experience these complications should be treated in specialized rehabilitation centers.
And how do you treat thromboembolism?
Well, first of all, we perform certain blood tests on a patient. If in his blood tests we see that iron levels are above normal, it is a sign. Secondly, we do an echocardiogram of the heart. Echocardiography result can be the second sign if right atrial to left atrial ratio is more than 0%.
Жүрекшенің сол жақ жүрекшеге ара қатынасы
The second criterion for such patients can be lungs computed tomography with contrast. This allows us to see how much is pulmonary arteries are covered with blood clots.
Контрастты затпен бірге өкпе тамырларының
Alternatively, on such patients we can perform what we call
жүргізілу керек.
angiopulmonography. This means that we insert a catheter through a vein and right into the pulmonary artery. Then we pass a contrast agent through the catheter and take an X-ray video. This procedure can show us how obstructed the pulmonary artery is and is there any blood clots in the pulmonary artery or not.
Өкпе артериясында тромб бар ма жоқ па? Сол жағдайды анықтап, ол науқастың жасына, оның жағдайына.
After thorough examinations, we prescribe treatment that entirely depends on the following criteria: patient's age, his condition, and whether he had any surgeries before. Usually, in our city clinical hospital number 7, these patients are prescribed catheter-directed thrombolysis. We leave the catheter in the same pulmonary artery for a day and inject drugs that dissolve the thrombus through the same catheter. The next day, we would check the results every now and then in order to see the thrombus was dissolved or not. In some cases, because of the patient's age or this thrombolytic therapy cannot be performed. In such patients, we use a special catheter to perform intravenous artery infusion procedure.
Sakin Murasulu, thank you so much for sharing this valuable information with us. We wish you good luck. Please take care.
Thank you very much for having me, for your invitation. I wish everyone strong health. See you.
Thank you. And now let's watch the video feature that was prepared by our journalists.
Year 2020 has brought great challenges to the people around the world. COVID-19 pandemic. This infectious disease has spread to all countries. Personally, I was very careful. I wear a mask. I didn't go to public places. Our family didn't leave the house. So I don't know whether my children contracted it first or it was wife Sharifa. So all of us, my wife and I, my son Sultan, my daughter Louisa, we all ended up having the coronavirus. We were treated in infectious disease hospital, and we want to express our gratitude to the doctors. A man called Bahit Kosaevich, the head of this infectious disease hospital, really helped us a lot. He said, "Dear sir, please take care." And then he was treating us with 4 fluids, my wife and my children. After that, he brought into our room this medicine oxygen concentrator. When I was in the hospital, I had my blood pressure and heart checked regularly. After the doctor had seen the results of my checkup, he said, "According to your ECG results, it seems that you have some problems with your heart. And also, your blood pressure doesn't look good." And I said, "Yes, I know. I was once admitted into the city cardiology hospital in Almaty. where there was that amazing doctor called Varovich. He treated me. I'm really very grateful to our doctors. It turns out that this COVID-induced pneumonia compresses the lungs and respiratory organs. The lungs begin to constrict, so the shortness of breath can occur. And that's exactly why doctors say it is important to do these breathing exercises. I'm telling you, these breathing exercises are the best treatment so far. Doctors also recommend discharged patients to be active, to take long walks or jog. At the beginning, 15-20 minutes are enough. You know, there were times when my blood pressure went up to 180, 190, 200. My usual blood pressure is around 140, 150, which is still too much. Some people can be shocked when they hear it. Of course, it is related to my age. Whenever I can decrease my blood pressure to 140, 130, I'm happy. Every morning I measure my blood pressure, and usually it is around 150, 160. So I take my drugs and I try to walk outside as much as possible, breathing properly during my walk. I take what people call traditional or folk remedy now. The recipe is quite simple. You need to mix garlic and lemon and wash it down with a glass of water. If you take garlic without water, it will kill all viruses, restore blood pressure, your heart will work properly, and COVID-19 will leave your body instantly. You know, since I'm an artist, I want to perform, I want to connect with the audience, I want to sing, to go on stage. You know, I really miss all of this. You know, it is in our blood, us Kazakhs. We cannot survive without big gatherings and celebrations, without dombra and songs. There are so many big celebrations, gigs, festivals in our great country. So I don't believe that it will cease to exist overnight. It is not possible. Our country, our traditions, our people are now getting better. There are so many discounts in certain places. The coronavirus is retreating, but it's still out there. We need to be careful. We need to wear masks and stay away from public places. And then we will win. Let's wait for those happy days. Let's stay strong. Those glorious days await us ahead.
Dear viewers, let me please introduce our next guests. This is a famous singer Ayjan Nurmagomedova. Welcome.
Ayjan Nurmagomedova, singer, honored artist of Kazakhstan.
And endocrinologist Banu Sarjankızı.
Banu Sarjanova, physician endocrinologist, second category doctor, Svendarov, Kazakh National Medical University graduate, head of the Department of Multidisciplinary Care.
Ayjan, how are you? You know, not bad. So we now have a lot of people at risk, right? It's a large group of people, although the pandemic is now under control. What is the age of these people? 60, 50. In most cases, this coronavirus infection is more common in people over 60, especially in people suffering from chronic diseases. But it's important to understand that the coronavirus does not discriminate based on gender or age. Everything depends on each person's health condition and life story, meaning it depends on whether these people have underlying health conditions or not. It is said that people with diabetes can experience the coronavirus more severely. What can you say about this as endocrinologist? It's true. This happens because a person with diabetes has a weaker immune system than a healthy person. So a compromised immune system is the answer. That's why COVID-19 is very common in patients with diabetes. Ayjan, did you self-isolate at home during the quarantine? This is the question I'm being asked the most. For 2.5 months, for 3 months, I worked as a volunteer. I refused to stay at home. Then my mother reprimanded me for it. She asked me why I was spending so much time volunteering with young people. So the first question everyone asks is, do you belong to the risk group or not? As you know, it means whether the person has any underlying health conditions. Things like diabetes, bronchitis, this kind of chronic diseases, you know? Heart diseases. Yes, in all kinds of heart diseases. You know, after 40 years on stage, we were not able to prevent ourselves from these diseases. So we all have them. Aren't you afraid of contracting COVID? How can one possibly not be afraid? It seems to me that only fools are not afraid of that. We all are afraid. But I'm very meticulous about safety measures. So whenever I am out there volunteering, delivering food to those old ladies who are in their 80s and 90s, I make them wear masks. I wear a mask myself. Then there is the test. We took the test twice. And you know, there are actually certain people who have all reasons to be afraid of COVID-19. Do you know who I mean? Doctors. I've met some doctors, young doctors. They work in airports meeting foreign visitors. I believe these are the people who should be included in the risk group. It's all about being careful. We all should be careful. So what are your safety procedures? I always wear a mask at all times. Also, I wear gloves. And whenever I get home, I throw them in the washing machine. I wash my hands several times properly with soap. So I'm being very careful. Whenever I watch TV, I see people who would just take off their masks and go to the market. People visit citizens' service centers. They go to all kinds of places. Some of them don't wear face masks at all, or properly. You know that. We all need to be more careful. Way more careful. You're right, Ayjan. This disease can affect people of any age. See how many there are young people with COVID-19. I think the majority of infected people are those who weren't careful enough. And now, let us watch the video feature about you that was prepared by our journalists. Ayjan Nurmagomedovan's personality is different. Are you afraid? It's not a question. No such question exists in my life. I can just stand still. I mean, I'm never afraid of anything. Never. This is my personality. I inherited it from my father. So when the volunteers asked me to become their ambassador, how could I say no? So many people don't get it. They don't understand why I am doing this. And I'm really surprised whenever I meet such people. How can I stand aside? If I don't go, who will? And what if all people are too afraid? What would that mean? That we will all stay at home? That we won't help each other? So we are all afraid, people like me, people of my age, both women and men. Then what's going to happen to our country, to our common home? What will happen? That was my mindset when I started volunteering. There were 150 young people by my side. Among them were students, future doctors. I saw them working in the airports, testing foreigners, being so happy when those tests turned out to be negative. How can I allow myself to be afraid if they are not afraid? There were no places we haven't visited in this 2-3 months. You have no idea. We wore masks, we delivered food. I volunteered to help the elderly, old men in their 80s and 90s. Imagine, if we don't help young people, who will? Our country is our motherland. And you have to do good things. And this is the life of the artist, you know. It's all about joy, about cheering people up, even when the artist's heart is being torn apart. This is why we all need artists. You know, to be honest, I don't have any awards, medals, nothing. And it doesn't really matter. I've been blessed by the elderly instead, by the people who are over 80 and 90. They wish me to live long. And I guess this all comes from my upbringing. My father used to tell me, don't you ever say, I can't do it, I don't want to do it. Say, I have to do it. And this is where my determination comes from. We are united. Banu, you see, Ayjan always wears a mask and she's always in high spirits. Can this be effective too?
әрине әсер етеді.
It can definitely be effective.
Көңіл-күйдің көтеріңкі жүруі, иә, позитив.
Being in a good mood and being positive
Бірден
is one of the best ways to fight the coronavirus.
күресу әдістің бір тәсілі.
So this is related to hormones, right? Yes, this is related to endorphins.
яғни эндорфин.
So do you mean that if there is enough endorphins in the body, one might be less susceptible to disease? Yes, that's true. You know, I have bronchitis, chronic bronchitis. Patients with chronic bronchitis and asthma. And what about thyroid? Well, no, you were telling us about the endorphins, right? So I guess I have a low level of endorphins. Why? Because you see, all my life, my weight was around 46 kilograms. Then 50, then 53. And now, this is not a typical quarantine fat, you know? It didn't happen during the quarantine. This is because of hormonal disbalance. This happened as a result of hormonal changes. And you know that when we get older, we gain this belly fat. So what do you call it?
Гормоналды өзгерістер
This can happen because of hormonal changes
және де дененің артық
and excess body weight.
семіздіктен соның әсерінен дамуы мүмкін.
No, I mean excess weight happens because of this.
Коронавирус,
It is said that the coronavirus can increase blood sugar.
яғни
Sometimes even those who have never had diabetes have their blood sugar increased due to the infection.
қант мөлшері көтеріліп
What can you say about this?
Иә, мен оған
Yes, I agree with this.
ол менің тәжірибемде.
I had such patients, you know.
Оның негізгі
However,
себебі
it entirely depends on the patient's life history.
тарихынан бастау керек. Бұл
Because, you know, we prescribe glucocorticosteroids to patients with COVID-induced pneumonia.
көп жағдайда
And this glucocorticosteroids play a major role in the breakdown of carbohydrates.
олар өз алдына көмір
Therefore, this factor can lead to diabetes.
алып келеді өз алдына.
But this has not yet been fully studied.
Бірде осы қант диабетіне алып келуі
We cannot say anything for sure
әлі толық зерттелмеген,
without studying this phenomena
толық
further
үзілді.
and in more detail.
Бірақ
But all these factors combined, so such risks exist. Yes, to some extent. Can the anti-COVID drugs, which are included in the treatment protocols, increase blood sugar?
коронавирусты пневмония
Well, glucocorticosteroids that are being used for treating COVID-induced pneumonia can cause this.
біз қосамыз.
Drugs like dexamethasone.
Метазон сияқты
This treatment can lead to the disruption of carbohydrate metabolism.
стероидтар өз алдына
Therefore,
су алмас
blood sugar
алып келеді.
levels may rise.
Қандағы қант
These facts must be taken into account.
сол жағдайда ескеру қажет.
You know, girls, I haven't understood even half of what you've just said. You're talking about this new drugs, about the disease. I didn't understand any of this information. But what I have understood is that I'm now being in a risk group, right? I'm getting older. So how can the people of my age be protected from this disease?
жаман аурулардан қалай қорғануға тиісті?
Ең бірінші
Well, first of all, of course,
өмір
it's all about a healthy lifestyle.
жаяу жүру, күндізгі уақытта
You need to take daily walks,
тамақтану,
eat on time,
киіп жүру,
wear a mask,
және өзін өзі көпшілік орын
and stay away from public areas.
және сыртқа шыққанда
Whenever you go out, whether it's outside or in the stores,
уақытта
you should disinfect your hands with sanitizers on a regular basis. And at home too.
ондай қорған
So nothing special,
мен ұсынбас едім.
no extreme measures,
осы жол.
only basic rules.
Коронавирус туралы үйде бол деген
You know, we made this song and a video about the coronavirus called Stay at Home. So we shot a video. There were young singers, stars all together.
біз ана айтады ғой.
However, we took all needed precautions. And instead of filming it all together, we filmed the video one by one person at a time. Exactly, one person at a time. And then we just edited all the bits together. This was a great video. There were clips from all over the country, and even from Belgium. I think these things are really important. And talking of coronavirus, is it true that the virus can affect the nervous and hormonal systems? It can affect body thermoregulation too, right? Some people feel cold or sweat excessively, even without having a fever
температуралары жоқ.
or a high body temperature.
Адамдар қалшылдап, дірілдеп,
How is it possible?
осындай сезімдер бастарынан өткеріп жатыр. Бұл неге байланысты?
Another question is,
қосымша сұрақ болсын. Неге айтады?
how can we treat a loss
Көп болмаса да,
of taste and smell
қызуы, дененің қызуы көтерілмесе де,
when there are no other symptoms
мұрындық иіс, соны сезу.
and people don't feel any body temperature, any fever?
Соны айтасыз.
Ол ең біріншіден
First of all,
бұл індет тек қана
you know that this virus can affect the entire body.
ағзамға да әсер етуі мүмкін.
It may cause multiple organs damage.
Оның барлығы ең біріншіден орталық жүйке жүйесі
All this can lead to the destruction and dysfunction of the centers that regulate the sense of smell, taste, and thermoregulation
және терморегуляцияны реттейді.
because of the central nervous system damage.
Қызметінің төмендеуіне әкеліп соқтырады.
As a result,
Салдарынан
we have excessive sweating,
жаңағы дәм сезу,
we lose sense of taste or smell, we feel cold, even if it's hot outside.
сондай жағдайлар
But for now, we don't know if this effects
қазіргі жағдай
can last longer than 2-3 months.
қай уақытқа дейін созылуы
The disease hasn't been studied properly yet.
болмаған. Ол мүмкін 2-3 айға
All these facts are to be studied and explored further.
созылуы мүмкін. Сондықтан
Sometimes the symptoms can last up to half a year.
өз жаңағы бойында
That's why everyone should take care of their health and all the symptoms.
және де соған сабырлық
It's important to monitor your condition and wait until the symptoms will disappear. And what should people do if the symptoms last for a long time?
Тіпті өз-өзіне қол жұмсау.
Sweating, discomfort, depression. I heard that some people even want to take their own lives.
тәжірибемізде
There have been such cases in our practice.
ұзақ уақыт
In this case, if the symptoms last for a long time,
жердегі дәрігер
it's necessary to see your doctor.
міндетті түрде
Рахмет.
Thank you, Banu. This was a very interesting conversation. Ayjan, do you have anything to say to our fellow citizens, to your compatriots?
Бәрі жақсы болады деп.
I believe that everything is going to be okay soon.
Үмітіміз
Let's not lose our hopes. Thank you for coming here today to our studio. Keep being positive and healthy.
коронавирус.
COVID-19 has shaken the entire world to its core. And now, let's find out how it affects people with cancer. We will now discuss this topic with our next studio guest, Айгерим Салыбекқызы. She is an oncologist and mammologist. Welcome. Thank you.
Aygerim Nurmatova, oncologist, mammologist. Oncologist, mammologist, Regional Diagnostic Center Almaty. Graduated from Asfendiyarov Kazakh National Medical University, General Medicine Faculty. Passed her internship training in therapy, resident in the oncology specialty at the Kazakh Medical University of Continuing Education. During the pandemic, doctors volunteered to work in the infectious disease hospital as attending physicians.
Aygerim, how are you?
Жақсы, рахмет.
Good, thank you. How are you?
Амансыздар ма?
Are you okay? COVID-wise? Yes, thank God we're fine. Of course, we all have already had this coronavirus in our family.
Жазылып шықтық.
But now everything is good. We have recovered. So let's talk about how this virus affects people with cancer.
Әсер етеді.
Well,
әрине коронавирус
we all know that coronavirus infections, including COVID-19,
иммунитетті
lowers people's immunities significantly.
онкологиялық науқастар
And cancer patients are twice as weak compared to healthy people.
науқастар сол үшін
So you can imagine that it can be very difficult
ауыр
for those people.
ол кісілерде бірақ енді
But some of them are feeling better now.
жайы бар
Жазылып кеткендер көп па?
How many of them?
ауырған
Well, for example, among 100% of patients, only 1-2% were cancer patients.
бірде 2% онкологиялық
So not too much.
болды қатты көп
Because you know many of them were isolated at oncology dispensaries.
болды және
Also, oncology centers
диспансерлер
weren't working during quarantine.
көбіне жұмыс жасамады карантин
So they would have their PCR tests made
міндетті түрде
and then get back into isolation.
қабылдап отырды соның барлығының
As a result,
деп ойлаймын
there weren't many cancer patients among the infected. Mostly diabetes patients were affected.
және халықтың арасында
There are many patients with this disease.
ауру деп жатады ғой сол аурумен көбіне науқастар
And when a person with cancer
Жалпы
gets infected with the coronavirus,
ауруына шалдыққан адам
does the coronavirus mutate?
ол мутацияға ұшырай ма коронавирус?
You know, currently,
бүкіл әлем
the entire world is dealing with this new virus,
індет болғандықтан
this new epidemic.
ақпарат аз.
There is very little information about it at the moment.
Бүкіл әлем
Of course, there are a lot of ongoing studies happening in the world right now.
бірақ осы күн
But more than half a year has passed since the beginning of the pandemic,
мутация
and there is still no specific research or publications about mutations.
баспалар
They are not available at this moment. But of course, cancer patients have more serious complications.
науқастарға
It's harder for them.
асқынуы ауыррақ өтеді, ауыррақ болады.
However,
дәл осы
at this moment,
жасушалардың мутацияға
there is no information regarding the mutation of cancer cells. And if these patients contract coronavirus, does it mean that their treatment will turn into a long process?
қарағанда онкологиялық науқастар
Cancer patients are more susceptible to all kinds of infections than other patients.
төтеп беру
This is directly related
себебі
to the fact that their immune systems
төмен
are
болған.
compromised.
Және де
They usually have a lot of underlying health conditions, such as hypertension, high blood pressure, many other diseases. Therefore, it can be very difficult for them both when they contract the infection and when they're being treated for it.
асқынуы жүруі де ауыр болады.
There are different types of cancer patients, right?
әртүрлісі болады, иә?
Are all of them now at risk,
топқа кіре ма, әлде
or only certain types?
түрлері ғана ма?
жалпы онкология
In general, patients suffering from any type of cancer are at risk.
қауіп-қатер тобына кіреді. Ол жеңіл
Whether it's mild or severe,
онкологиялық аурудың жеңілі жоқ.
of course, when it comes to oncological diseases,
Өлшеміне қарай.
there is no such thing as mild.
Бірінші стадиядағы, екінші сатыдағы деген сияқты. Сол сатыларына қарай.
But it all depends on the stage of cancer, tumor size, cancer has stages, first, second, and so on. Risks can be higher depending on the stage. If, for example, there are patients who receive chemotherapy or have received chemotherapy recently, they have deficiency of all three main blood components.
Көпшілігінде деп айтайын.
It's called pancytopenia.
Жаңағы деңгейі, көрсеткіш деңгейі төмен түсіп кетеді. Панцитопения деп аталады.
And of course, because of this condition,
Төмен
their immune system is fully undermined.
мүлдем жоғалады десек те болады.
So these people are especially susceptible
Жұқтыруы жоғалады.
and are at bigger risk than the others.
Сатуға болмайды.
It's impossible to stop chemotherapy once you start it.
Жұмыс істеген
You've just mentioned earlier that many clinics didn't work during quarantine. So how did you work with those patients?
Жалпы айтатын
Well, you know that cancer is a chronic disease.
ауруларға жатады.
It is considered a chronic disease, and this COVID-19 is considered an acute infectious disease.
Инфекциялық ауру.
So, of course, all hospitals are primarily focused on the treatment of acute disease.
емдеуге мән береді. Бірақ
But of course,
химиотерапияны
there are patients who need chemotherapy.
уақыты таяп қалды.
Their lives depend on this therapy.
Соның
Say they might need to receive the 5th round of chemo. The 4th round is over,
немесе ол
and now it's necessary to receive the 5th round of chemo. And it's possible that right at that time, this patient can have all those symptoms, So it's important to tell his doctor and to listen to his recommendations. Doctor must be notified. All complaints should be voiced. I have a fever, I feel bad, and so on. Then whether it's a chemotherapist or an oncologist,
қан
they will examine his blood tests.
ол науқас
They will examine the patient, and first and foremost,
және
they will have to postpone chemotherapy. Because of low blood sugar and immunodeficiency, such patients cannot take medication for a coronavirus infection.
ол жаңағы коронавирусты инфекцияға арналған
If they do, it can affect them negatively in a way that can be twice or even 3 times more life-threatening for this patient. There can be side effects.
зиян тигізуі мүмкін. Одан да кері әсерін алып аламыз.
Andrei Kaprin,
ресейлік
a Russian oncologist, estimates that the number of cancer cases will double after the pandemic.
шалдығушылардың саны 2 есе
Can you explain to us why?
неге байланысты?
Енді
Now, as you said, these projections are still being studied.
зерттеледі де.
So it's possible that the increase in the number of new cancer patients
Енді мүмкін жаңағы
may be related to late complications of this coronavirus infection,
кеш асқынуларынан болуы мүмкін.
COVID-19.
Инфекцияның, яғни COVID-19 инфекциясының кеш
For example, residual fibrosis in the lungs,
мысалы өкпеде
untreated fibrosis,
толығымен тартылмай қалған
may eventually develop into cancer over time,
уақыты өте келе кейін
or of course, due to some other factors, it may trigger automatic cell growth.
факторлардың әсерінен
But for now, of course,
клеткалардың автономды бөлінуі өсуі
it's nothing but a guess.
әрине ұлғаюы мүмкін, бірақ әзірге ол әрине
But are there any risks?
Қауіп-қатер бар, иә?
Of course, these risks exist.
Әйгерім
Әйгерім Салыбекқызы, in your practice, have you ever had a patient with cancer and coronavirus?
коронавирус жұқтырған емделушілеріңіз болды ма?
You know, although I am an oncologist, mammologist,
осы әлем
our whole world is in turmoil right now.
кейін біздің
And after this new pandemic came to our country,
пандемия сол кезде
we've seen lots of messages coming from the Department of Health.
мессенджер жаңағы
We started to receive those messages on WhatsApp.
дәрігерлер жетіспей жатыр.
And every single message was about the shortage of doctors.
Мен өзім ойланып шешім
So I made my mind.
сол
I wanted to help my colleagues who were out there fighting the disease.
адам
So in order to serve humanity,
өзім
I decided to get a job at the Infectious Disease Center.
жұмысқа
I stayed there from July to August.
шілде айынан бастап
I was helping and treating patients there.
емдедім, иә, науқастарды. Қазір
Currently, both the minister and the Ministry of Health
пандемиялық жағдай
say that the epidemic situation in the country
енді министр
has stabilized.
денсаулық сақтау министрлігі де сол тұрақтан
After the stabilization, the infectious disease hospital was temporarily closed. That's why I'm here now. Why I have time to give interviews, you know?
иә болды, бірақ көп емес, екі
But
науқас
it all happened for real. There were some cancer plus COVID-19 patients.
кейінгі науқас
There were pre-surgery patients. There were post-surgery patients.
19 инфекциясы
We treated cancer patients with COVID-19 infection.
онкологиялық жаңағы дерті бар.
A patient with cancer was hospitalized for 14 days.
Шүкір емделіп
In the end, he was cured and discharged from the hospital.
отаға әрине
Of course, we recommended him not to have the surgery yet.
ол кісі
This was because he needed to undergo a full rehabilitation course in order to completely eliminate fibrosis from his lungs that formed because of COVID-19 disease.
жаңағы
It will take some time before this fibrosis will dissolve, so doctors will examine his CT scan, and he will have to repeat this CT scan after he finishes his rehabilitation course.
толығымен
If everything is gone, if fibrosis disappeared, he will take a PCR test, all the blood tests needed,
анализін тапсырып, одан ары қарай
and only then he will be ready to prepare
тізім
for his surgery.
тізім бойынша бәрін тапсырып, отаға
By the way, what do you do if you need to operate on a cancer patient urgently
ісігі бар,
and he has coronavirus?
ол коронавируспен ауырып жатса не істейсіздер?
As I have mentioned earlier, cancer is a chronic disease.
созылмалы
Therefore, first of all, this coronavirus infection has to be treated first, and only then the patient can be fully prepared for surgery.
емдеп толығымен
Until then, no surgery is allowed.
дайындалады. Оған дейін
This is due to the fact that even after surgery, when the immune system is compromised,
себебі отадан кейін де
it will take ages for this patient to recover.
ұзақ болады. Отаның орны
And you know, post-surgery recovery
және
will be difficult too.
қиын болады.
What about the treatment of patients with cancer? Is it any different from the treatment of healthy patients with coronavirus, or is there a separate protocol? Is there another treatment?
Оларда бөлек хаттама бар ма? Өзгеше бір ем жоқ.
In general, there is a COVID-19 treatment protocol approved by the Ministry of Health,
Осы Қазақстан
according to which the treatment is usually carried out.
бекіткен хаттамасы бар.
However, it's not fully suitable for cancer patients.
Алайда енді онкологиялық науқас
Take hormone therapy, for example.
бірақ
When treating cancer plus COVID-19 patients, we try to decrease the amount of hormonal drugs they take.
препараттарды, дәрілік заттарды
Because hormonal drugs For example, dexamethasone, prednisone.
гормоналды жаңағы
These drugs suppress inflammatory processes in the body,
кортизон дейміз, преднизолон дейміз.
but they also suppress the immune system
Ағзадағы қабынулық
because cancer patients usually have weakened immune systems.
төмендете отырып басады.
We try not to proceed with hormonal therapy.
Иммунитеті төмен болып тұрғандықтан
Also, there are cancer patients who are depressed
егере тұрамыз.
and they become even more depressed
Сонымен қатар
when they get COVID-19.
COVID-19 инфекциясын жұқтырған науқастарда көбіне
They might have fear of dying,
өлімнен қорқу,
depression,
депрессивтік жағдайлар,
or an unstable nervous system.
жағдайда келеді. Сол кездерде жаңағы
Secondly, in some cases,
жағдайда тағайындаймыз.
we prescribe B vitamins to COVID-19 patients.
Дәрумендерді Б тобындағы дәрумендер.
However, in cancer patients, we use these vitamins with great care.
Енді
This is because studies have shown that B group vitamins can trigger cell growth,
жаңағы
which can only intensify cancer.
бөлінуін, яғни өсуін қатерлі
Now, in my 1-month practice,
деген.
I have treated a patient with cancer.
Енді менің тәжірибемде
Of course, he was very depressed.
науқасты өзім емдедім.
He was asking me questions like,
Әрине,
is this the end?
депрессивті жағдайда болды.
Should I prepare to die?
Мен өлуге дайын.
And the problem was,
көптеген сондай сұрақтар.
we couldn't summon a psychologist to see this patient.
Сол бір науқасымыз
So he was treated for 14 days, and the treatment results were unimpressive at first. There was also a shortage of oxygen.
ауа жетіспеушілігі де болды.
And then we started him on oxygen therapy.
Енді қостық ол кісілерге
We performed a new etiological treatment. He survived because we have combined pathogenetic and then symptomatic treatments. You mentioned this dexamethasone. It was in high demand when things got worse with the pandemic. Everyone tried to get this medicine from the pharmacies, whether they were sick or not. Have you ever had a hard time getting this medicine?
Стационардың
Well, in the hospitals, all medicines were sufficient.
болды. Енді дәл мен
I'm talking about the period when I was working there, from the beginning of July to August.
жасаған уақытта
Back then, all the drugs were sufficient.
дексаметазон да болды.
As for dexamethasone, of course, there were speculations in pharmacies. There were those horrible people trying to earn money while patients were suffering. There were panic buyers,
деңгейінде жеткілікті болды.
and because of them, other people couldn't buy medicines.
Гормональды препарат
But in the hospitals, we had enough medicines provided by the government, whether it's anticoagulants, hormonal drugs, everything. As for insulin, it is the drug that diabetes patients need most of all. There was enough insulin for those patients too, and supply of oxygen concentrators has now become regular too.
қазір көп
Many doctors these days shift to online sessions. Are you among one of them?
бұл тәжірибені қолданып жатсыздар ма?
Of course, at the beginning of the pandemic,
Басталған уақытта мен
when I was working as an oncologist mammologist, before I took the job at the new infectious disease center,
ауыспаған шағы
I conducted online consultations,
консультациялар
and I still do,
әлі де жүргізіп келемін.
because there are so many questions.
Өте көп жаңағы
Now, being an oncologist, you know, we don't have free time at all,
науқастар шыдай алмайды түнде де күн
whether it is day or night.
өйткені
Patients send private messages on Instagram too, you know.
ана
Of course, sometimes you are tired
өзің
and you want to take some time for yourself,
өзіңді аяйсың кейде.
but when they text you, you can't refuse. Some would text and say, "Can you please have a quick glance at my mom's blood test results? She's really ill."
шыдай алмайды.
So when you see these requests, you can't say no, you want to help. During the pandemic, I conducted free online sessions too.
Консультациялар.
Thank you very much for sharing your experience with us. We're so grateful to you. We wish you good luck. Thank you. Thank you too.
Коронавирустың
Fear, anxiety, and panic attacks are among the most common symptoms of coronavirus. What should patients do when they experience these unpleasant symptoms? Let's ask a psychologist. When the first coronavirus cases started to appear in our country, it was said that patients suffering from chronic diseases, elderly, are at risk. And when this information became public, so many people started to warn their friends and relatives.
отбасыдағы жаңағы
You are in danger.
қаласын шықпашы.
You are sick. You shouldn't be leaving the house. Don't go out.
Негізінде
Stay home. And so on. You got the idea.
Адам біз
So these people were not allowed to leave their homes at all.
бізді жалғыз
And at the very core, we are social animals. We need society. We need people. We're well accustomed to them. We can't live without communication. You know this uncomfortable feeling that you have when you're left alone. So many people suffer when they are left alone. So of course, one can always visit a group of relatives. But in our culture, it doesn't. Because every single visit will be about how are you, what you've been up to recently, aren't you sick yet? And this is not a proper way of communicating with people. There should be more fun in communication, more humor. In September, you know, many people see their grandchildren go to school for the first time in their lives. So the advice is be around children more. Watch them dancing, reciting poems, have fun. Also, you have to be more selective when it comes to helping people. In our culture, people are too focused on helping others. Their relatives, parents, and kids, instead of helping themselves. You see, as Kazakhs, we do not adhere to rules properly during the quarantine. Why? Because we got used to taking care of other people, of someone else's well-being, not ours. I don't want to offend him. I don't want to disappoint her. I don't want them to think ill of me. That's why whenever we get invited to the wedding celebration, we say to ourselves, it would be such a shame not to go. I'm being invited to the celebration. It's such an honor. I must attend. Another thing is that whenever we meet our acquaintances on the street, we would hug, we would kiss. And it doesn't matter if you have COVID-19 or you don't. If you have it, you should really think about other people's health and well-being. You shouldn't approach them. We lack the sensitivity when it comes to these matters. Today, I see many people who do not even want to be treated, especially the elderly. And there are a lot of people who have been sick for a long time. Why do these people act like that? Because they are depressed people. Because a person who has been sick for a long time is never in a good mood. So he would always say, "Get lost, I'm tired." Some people are very scared of doctors. They think, okay, I will go to see a doctor, and then he will diagnose me, cut something off. What am I supposed to do next? I don't even want to hear about it. These are the people who are very good in self-deceit. They lie to themselves by saying that they don't have the disease, that they don't believe in it. That's why such people often do not want to go to see a doctor. They don't want to be treated. If possible, such people should be taken to a psychologist. Nowadays, the internet is full of fake information. Many people believe it, especially old people. Who publishes such information? Who sends it? First of all, let's divide these people into separate groups. First, some intend it as a joke, just to have a laugh, you know? Second, there are those who text these nonsense messages with pleasure, enjoying seeing other people suffer. This kind of people really exist. They publish such messages. Then there are mentally ill people. People no one will ever suspect because their disease is at the early stage. Now the question is, why does this kind of information spread so fast? This flood of fake news can only be stopped by a person who received it and didn't send it further. But this doesn't happen. Why? Because when we are scared, we tend to read. When we are scared, we need more information. When there is a lot of misunderstandings, we usually seek more information, and then it happens that we start sending these messages to our relatives and friends. We send it thinking that this information might be able to help our loved ones. Infodemic happens. We should not forget our Kazakh proverbs. Only the devil doesn't have hopes, and a kind word is half the deed. We must never forget these wise words. We must always have hopes and we must think positively. If we think positively, we will know how to avoid the bad things and then we will survive this disease. That is all for today. This was Ulken on Kazakh TV channel. See you soon.